What's up, everybody? This is Nurse Blue, and I just want to tell you I am having such a beautiful day, and I hope you are too. But I have some information that I think you need to be aware of. Listen, guys, how many of you have a medical doctor, right? I hope all of you do, okay? Do you know that they are estimating that over 100,000 medical doctors are leaving the profession in the next 2 years? I want you to think about that. 100,000 medical doctors are leaving the profession in 2 years. Guys, we are headed for a big problem because guess what? There's a major nursing shortage. So if you don't have doctors and you don't have nurses, but you got health problems, what are you going to do, Houston? What are you going to do? What are you going to do? What are you going to do? Listen, the best way to prevent the problem is not to be reactive. You gotta be proactive. So this is happening. You might be asking, Latrice, well, why are people leaving the medical industry in record numbers? COVID. Well, actually, it's a lot of reasons, but here's number one reason. Number one, people are burnt out. Guys, look, when you were watching COVID and seeing day after day people globally dying from this deadly virus, guess what? I mean, these are the people who are on the front lines. COVID burnt them out. COVID burnt people out physically. These people were day after day treating people with this harmful disease. They were scared to death of catching it themselves, scared to death of taking it home to their families. Do you know how psychologically debilitating that is? They were seeing death after death after death, dealing with family members who couldn't get in to see their loved ones. That's emotional trauma. How many of them physically had to endure it themselves? I know doctors who got it over and over and over and over and over again, even with the vaccines. Even with the vaccines, they were getting it. Yes, and guys, you know, at the end of the day, you know, all things have a breaking point. People are burnt out, absolutely burnt out. Okay, so that's a big reason. Now, in the nursing profession, there's a lot of interesting stuff happening there. First of all, nursing has been, I mean, for years, there's been a shortage. COVID just proliferated. I mean, COVID just took it way beyond a shortage, right? Now, here's a few things that's happening. People retired when COVID hit. Some retired early. Some people left the profession altogether. But many are burnt out. Then here's the other piece that's happening. There are a lot of professors that left the profession. So now you have people who want to go to nursing school, but now you got you have a shortage of faculty. I mean, for nurses. So there are so many things happening at one time, yet Americans, and I can't speak to people all over the world, but I can speak for this country, we're getting sicker and sicker and sicker and sicker from preventable diseases. 98% of chronic disease can be prevented, but you're not preventing them. So that means that the problems are increasing. So do you guys hear what I'm saying here? In the next 2 years, and particularly, let me speak to women as well as men, but I'm speaking to women because oftentimes they are making the decisions around healthcare in the household for usually helping their husbands, their parents, and definitely their children, if that applies, and if not, herself. And her health, when she is not well, everything is impacted by it. So girl, this is what I need you to do. I need you to make your priority right now upgrading your wellness strategy. I need you to upgrade your wellness strategy to Soul Health. So if you want to prevent yourself falling into this place where chronic disease becomes a problem and now you done got hit by the shortage of a doctor or a nurse or whatever the case, you just need to know how to detoxify your body so we can eliminate a preventable chronic disease. But more so than anything, you can learn how to build, love, unite, and empower yourself with Soul Health, okay? So click the link, guys. I have a webinar. You'll learn about the webinar. I actually have a free gift where you can come and try out Soul Health free for 7 days. You ain't got nothing to lose. And by the end of the 7th day, if it's not for you, no problem, cancel it. And if you want to stick around and learn more and more about this so you won't be reactive to this crisis that I'm speaking of. And this is real, guys. This is real. Many of you right now are taking medications for preventable diseases, and you don't like taking the medications, which I don't blame. That was me. But you need a strategy so you can stop, or at least bring your body back to balance, okay, as much as possible. And I think any doctor or nurse would consider that to be a really great thing if you learn how to empower yourself as you're going through this, as we're navigating the effects of what COVID has done to the medical industry, but what is to come. What is to come? Okay, so right now, guys, I've given you enough information. You're gonna click the link, go to soulhealthcommunity.com, receive the free gift, free. I'm investing in you first, and then afterwards, it's just 30 cents a day. Now, sweetheart, beautiful, boss, girl, chick, whatever you want to call yourself, I'm never gonna disrespect you. I want you to know you are certainly worth more than 30 cents a day. Okay, to me, you're priceless. But you might be asking, well, is Soul Health worth not 30 cents a day? Absolutely. Let me just answer it for you. Absolutely. Ain't no sense in us even worried about that. So check out the webinar. Come and see me. Can't wait to see you in the community. And I hope this was helpful to you guys, and I hope it made sense, okay? And in the webinar, I talk about it in full detail. So if you want to know more about what's happening, I talk about it in full detail in the free webinar, okay? All right. See you later, guys. Have a great day. Bye.